Welcome to our Caribbean and African Targeted Health Improvement Programme, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Okay, good morning everybody and welcome to this weekend's CAHN Health Hour. And we're fortunate to be joined by Dr. I. Fortune Glavee, an dental oral surgeon from London. Before we start, I'd like to welcome everybody from around the world who's here with us today and viewing the session from different platforms, including Facebook, LinkedIn, YouTube, and of course through this link here today. Now, we know these sessions are really useful and really insightful, so please don't forget to share the links with your friends, family, and anyone else who you think may find it useful. Now, without further ado, let me introduce Dr. I. Fortune Glavee. So, as mentioned, she's an innovative dental surgeon, and when she's not busy saving people's teeth and oral hygiene, she is an innovator. She's been part of the NHS Clinical Entrepreneur Program. She is a poet, a mentor, and she has a great philosophy on life. So I'm sure, just like me, you're excited to hear what she's got to say today on oral cancer. And without further ado, let me pass you on to her for a great hour of learning.
Thank you, Chido, for the introduction, and thank you, CAHN, for inviting me. And thank you to all the listeners. I'm so pleased you've joined. And I'm going to start sharing my screen. Thank you. I hope you can see. Yeah?
Yeah, perfect. Thank you.
All right. Okay. So today we're going to be doing oral screening, do it yourself. So before we start, please go and wash your hands, get a mirror, go stand in front of a mirror and a torch. You can use the torch light on your mobile phone because this is do it yourself and it is oral cancer screening. Sorry about this.
That's okay, Dr. Glavee. Whilst you get sorted, I'll just remind everyone, if you have any questions and if you have any questions that you want to ask during the session, please feel free to enter a question within the group chat or raise your hand up at the end and we'll be able to answer those. But I'll pass you back on.
Thank you, Chido. So this is the learning outcomes. we'll be focusing on understanding the risk factors associated with oral cancer. This is not a diagnosis, this is a screening. There's a difference between screening and diagnosis, which I will speak about later. Recognize the clinical signs and symptoms of oral cancer, and then performing the screening examination, which is doing it yourself. That is why it is important to wash your hands, stand in front of a mirror, use the touch from your mobile phone or any touch that you have at home. So we're going to do it now. I'm not going to be wasting time. So as you can see on the screen, this is the 2 minutes do-it-yourself self-examination that could save your life. So we're going to start with the face. If you look at your face, half of your face and the other half of your face is like a symmetry. So it's like a mirror image of the other. So look at your face, see if there are any lumps on your face, any spots, any skin pallor, like discoloration. You know yourself because you are with yourself 24 hours. So you will be able to see what is different. It's very important to know what is the norm and what is the abnormal. Oral screening is just to make you alert. Knowledge is power, to give you that knowledge. So it is very, very important that you do this 2 minutes, do it yourself. That could save your life. So we're going to start with your face. So feel your face. Can you feel any lump from your forehead to your chin? See if there is any symmetry. So what is symmetry? Symmetry means the other side is similar to the other side. We do know in anatomy that there are times half of your face may be a little bit bigger, or your left foot may be bigger than your right foot, or your left breast may be bigger than your right breast. But looking at your face, you need to be able to look for any anomalies, anything that is different. Are there any lumps on my face? Is there any discoloration? Is there anything that is abnormal on my face? So that's the first thing. Have a feel of your face. The second one is the neck. Turn your face to the side and then your neck extends. Feel if there's any lump on your neck, anything unusual, any lump that feels different, that doesn't feel normal. What is the consistency? Is there any discoloration? I'm fully aware that for people who have more melanin like us, it's going to be very difficult to see any discoloration. But all the same, it is very important to look for the norm and the abnormal. The next thing we're going to do is to look at what's the third thing on my list? So we can move on to the lips. So look at your lips. We have the upper lip and the lower lip. Feel your lips. Put your finger underneath your lip and move it around and see, is there any lump? How does it feel? What's the consistency? Are there any ulcers, unusual ulcers? I'm fully aware that when the weather has changed and people are run down, some people suffer from ulcers, or if they are stressed, those sorts of ulcers clear up by themselves. If you have an ulcer for more than 2 weeks that has not cleared up, please seek medical attention. If you see an ulcer on your lip with raised borders or dry scab or something unusual, that is not the normal. As I said, a normal ulcer will clear up within 2 weeks. If after 2 weeks, in some books, they say 3 weeks, but I'll rather say 2 weeks. If after 2 weeks, things are not returned to normal, please seek medical attention. So feel your lower lips, upper lips. Is there any lump, any inconsistencies, any ulcer that is not clearing up? The next thing to look at is we can look at the gums. So smile and look at your gums. In melanin people, because of a lot of pigmentation, some people have got pigment on their gums. So in the Caucasian, their gums are white or pink, or I shouldn't say white. Apologies, it's pink. But in Caucasian and in other parts of the world, or people like us who have more melanin or more pigments, our gums may be pigmented. So it may have like black pigments on it, or it may not be pink. So if your gums are not pink and they are a little bit darker, it's basically due to more pigmentation and nothing to worry about, unless there's something abnormal about it. So if, for example, you woke up one morning, your gums are always pink, and then today it's a little bit dark, then obviously you know that there's something not right and you need to seek medical attention. Then we now move on to the cheeks. I want you to put your fingers in your mouth, pull your cheeks apart, look inside your cheek, use the light to look at your cheeks. What's the coloration on the cheek? Do you see any patches on your cheeks? Have a feel of it, any lumps on your face, anything abnormal, and have a feel of your cheeks. Any lumps, any discoloration, any consistency. And then now we move on to the tongue. Stick your tongue out and say, ah, and then you can see the back of your throat. You can see your tonsils. Does it look different? Is it swollen? And then you see something in the middle. It's called the uvula. It's so soft. And it's some people it vibrates, some people have it enlarged. And then now raise your tongue and look at the floor of the mouth, and then stretch your tongue. If you've got a piece of gauze, move your tongue to the side and check the lateral border, because if there is an ulcer there or a red or white patch, that is something that is telling you you need to seek medical attention. And then the floor of the mouth, especially putting your finger inside the floor and moving it along the border and going to the back, the retromolar area behind the tongue. Feel there. Is there any ulcer hidden there that you didn't even know existed? So I think we finished with the examination now. This has been a 2-minute to do it yourself self-examination that could save your life. In other words, what I'm trying to tell you, if there's anything you need to take from here, it's number one. If you find any lumps or anything unusual, please seek medical attention. If you have got an ulcer in your mouth, we are fully aware of cold sores and things. After 2 weeks, if it has not healed, please seek medical attention. If you see any patches, red patch or white patches, now in your mouth, there can be a white patch. If you use your finger to wipe that white patch and it wipes away, it's called trash. People have trash at times when they've taken certain medication or they have got low immune system, they are run down. There are so many things that can cause oral trash, or they are taking some medication. So yeah, so that is trash. But if you find a patch, white or red, that when you use your finger to wipe it, it doesn't come off, then please seek medical attention. So I'm saying, this is not a diagnosis. This is an oral cancer screening. Before you can be diagnosed as having cancer, we need to take a good history, your lifestyle, do extra oral examination, intraoral examination. We need to carry out tests, blood tests, even biopsy, scans, x-rays before we arrive at a diagnosis. So please do not be alarmed if you find anything unusual. It is best to seek medical attention. Thank you. So what led to this webinar? November in this country is dedicated to oral cancer. So since today being, I think, the last day of the month, today is 30th, the last day of the month, I think it is good to talk about oral cancer. And what's a better time to do oral cancer DIY? So that's why I decided to do oral cancer, because the whole of November has been oral cancer, creating awareness. So this is statistics. So in this country, between 2017 and 2019, all the cancers, about 3% was dedicated to head and neck area, the head and the neck area. And mostly the age group that were prone to that sort of cancer were between 65 and 69. I'm not saying it. This is statistics that is according to cancerresearch.org. And the trend is cancer is on the increase, unfortunately. And this is why we need to know what is going on. As I always say, prevention is better than cure. In this webinar, this is what we'll be covering, the ground rules. So if you've got anything or any questions, please put it in the chat. I'll be talking about myself. I'll also talk about what I've done in the past. And I'll be sharing some oral cancer screening and tips. We've already had a taster session and then question and answers. So about me, I'm a mentor, I'm a poet, I'm a teacher. I'm an artist. I'm an innovative dental surgeon. I'm the author of 3 books. I'm also a content creator as a result of the YouTube Health program. My philosophy has always been to make a difference, which becomes a ripple effect to inspire the next generation. So these are the books I've written: Positive Work-Life Balance, How to Transform from Tired to Exhausted Brain to Happy, Empowered, Fulfilled, using the toolkit. Mommy, What is Tooth Decay? Prevention is Better Than Cure. And Book of Poetry, Why I Create. I love voluntary work. So King's Global Day of Service, I went to Guy's Hospital to plant some vegetables and flowers. I also volunteered for TEDx London. I was part of the 2019 TEDx NHS, and this was the launch party at Oasis Farm. And this was one of my recent ones at the Royal Institution, 28 September 2024. I volunteered for TEDx NHS. These are other things I've done in the past. I am not what I have done. I am what I have overcome. During the COVID-19 lockdown, I took part in artificial intelligence in Corona Hackathon with data scientists. You can see my name there. And our team won the first prize. And what we came out with is that a simple blood test, if they do a simple blood test and there's increased monocyte, then it's likely you are prone to COVID-19. So that was research done online. I've also been part of clinician burnout conference because a lot of clinicians get burnout. They overwork themselves, so they need to take a break. They are humans. So today is oral cancer. It'd be nice to know what people think oral cancer is. If you know the definition of oral cancer, could you please put it in your chat, in the chat? So oral cancer is a malignant neoplasm or cancerous tumor. So what happens is, in simple language, just cells that become abnormal and start growing. It could be benign or it could be cancerous. Cancerous is when it spreads, which is quite serious to other parts of the body. And what are the risks? So when people come to the dentist, we always ask, we take their history. If you take a very good history, you'll be able to get a lot of information, like what is your lifestyle, your social history, your medications. At times, people don't want to tell us what medication they are on. So, for example, if you're allergic to penicillin and you do not tell me and I prescribe penicillin, there could be a problem. If you're on anticoagulants like warfarin, again, I wouldn't want to remove your teeth. Or if you're on apixaban, I'd rather send you to the specialist because they will need to do a blood test to check your clotting factors before a tooth is removed. And people may come and say, oh, my teeth is so loose, you can just take it out. I can take it out myself. If you're someone on aspirin and you've got blood disorders, taking that tooth out can lead to a lot of issues. And the reason we also ask for medical history is if you've had rheumatic fever in the past, infective endocarditis, all those things can spread. So it's very important that when we ask you certain questions, what medications you are on, because there could be interactions and we have to be mindful of that. So let's come to oral cancer. Always what I tell patients, if you live in this webinar today, one thing we normally tell people, oral cancer is a lifestyle disease. So if you smoke, I'm not saying it, if you smoke and you drink alcohol, these two combination, your oral cancer risk is high. I remember I never say it, but I remember I got involved in research, and this lady she was doing her PhD, and she interviewed me, and she said, "Do you tell people that there's a risk if they smoke and drink?" And I said, "Well, that word, the C word, that may frighten you." No, he said you have to say it. So now I tell people that, are you aware that if you drink and you smoke, your oral cancer risk is high? As if I tell them, at least I know I've done my job. And I also do a little bit of smoke cessation. Smoke cessation is I try to advise you to stop, because when you smoke, your gums are affected. Your gums bleed more. So this is an extension of a lesion on a tongue. That is why it is important to know what is normal and what is abnormal. Obviously, if you see this, you know that there's a problem. It's on the lateral border. But you cannot jump to conclusion because you don't know the history of the patient. You don't know if they've got any underlying medical conditions. In dentistry and medicine, there's something called oral manifestations of systemic diseases. So there are times that you may be suffering, you may be unwell, but it shows up in your oral cavity first. So that's why it's very important to be a little bit of a detective to know what is the normal and what is not the normal. So if you find something abnormal, then you need to seek medical attention. As I'm saying, this is an oral cancer screening. There's a difference between screening and diagnosis. So please, if you find anything abnormal, please do not panic. Please do not be alarmed because you need to seek medical attention and someone needs to do a full history, diagnosis, and carry out tests, and if possible, biopsy before they can arrive at a diagnosis. So please, please do not panic if you find anything abnormal. So I'm going to share some videos with you. That's a result of the YouTube health program. I have a video channel, and this video channel is to create videos to educate the public. All the videos you are going to see here were produced by me. I wrote the scripts. I did not film them. Instead of filming, I use artificial intelligence to do these videos. So all the videos you are going to watch were done using artificial intelligence. So yeah, so this is the first one.
Dr. Glavee, I don't think we'll be able to see the videos if you click on the links. Just
Sorry?
because I don't think we'll be able to see the videos directly.
Can't you see it?
No.
No, we can't because you didn't share that screen. You'd have to reshare the screen that the video is playing with the sound as well.
I've sent a copy to Sam. So can Sam play it from the area?
Yeah, just give me 1 second.
Okay, Sam, can you please play the videos on that screen? So should I stop sharing?
Yeah. I wonder whether it's useful to copy those links into the group chat so that people could I wonder whether it's useful for people to copy those links in the group chat so that then we can get our viewers to watch it at their own pace.
Okay, all right, okay.
I wonder whether it's useful.
Okay, that's a good idea. I've sent the links to Sam, so Sam
Perfect.
can put it in the.
We can do that.
If I can
Brilliant.
put it in the Sam,
group
can you
chat.
please put it in the link? In
Yeah,
the chat.
so I'm doing that right now, and so we can. I'll let you continue. Sorry for interrupting.
All right. Okay. All right. Okay. So it's worth watching these videos. They are very short. They are not very long. So the first video is what is oral cell carcinoma, which is it shows the squamous cell carcinoma, which is one of the most common carcinomas. And then the second video talks about leukoplakia. Leukoplakia is a white patch that does not rub off. And then the third video is oral cancer examination. So the links will be put in the chat for you to watch at your own time. Okay, so we've already done the DIY oral cancer screening, so I'll just move on. The videos were very important. I wish we could play it because you learn a lot. So I don't know whether we can play it at the end when I finish. So, okay, so this is a picture of a patient. Now, when you see this picture, what crosses your mind? You'll be wondering what is wrong with this patient. The reason why I've put this picture here is to let you know that you cannot just diagnose someone just by looking at any abnormality. Because yes, when you see this patient, you know straight away that there's something wrong along the lower jaw. But the question is, what is it? Could it be hereditary? Could it be an abscess? Could it be a benign tumor? Could it be a malignant tumor? Could it be a cyst? Could it be a salivary gland swelling? Could it be a metastasis? When people have cancer in different parts of the body, at times some of them can lodge in the jaw. Is it an anomaly or bone malformation? Is it due to hormones? Because there are some hormones that make you have big jaws, and it's called acromegaly. So at this moment, you and I, we don't know what this patient has got, but we do know that there's something abnormal going on along her lower jaw. And the only way to find out is by taking history, carrying out some tests, doing some diagnosis, maybe possible having a blood test, because when you have a blood test, it picks up a lot of things. But when a GP runs a blood test, they are able to pick up things. If they need extra information, then they carry out specific tests. So this is just an example. So seeing something like this, straight away, you know that there's something not right and you need to seek attention. This is intraoral. Again, this is a sagittal plane showing you if you divide the body in half, it's just showing you some of the parts of the oral area, the head and neck region. And then we have the sinuses. The sinuses are just above the teeth. At times, people suffer from sinusitis and it affects the teeth because the root of the teeth is in the sinus. And you may think it's a toothache, but it's due to sinusitis. And at times, you can see the GP for medication. And then there are times people suffer from nerve problems. For example, trigeminal neuralgia is quite a very painful condition. And people may think it's the teeth, but it's actually trigeminal neuralgia. Again, it's treated by the GP. At times they give them anti-epileptic, I think carbamazepine to treat it. So neuralgia and atypical facial pain, at times it's not necessarily coming from the teeth, and it's called referred pain, and that can be referred to the teeth. There has been instances people think it's a toothache and had all their teeth removed and the pain was still there. That is why it is very important not to do self-diagnosis, but to seek medical attention. What we are doing today, as I said, is screening, and there's a difference between screening and diagnosis. So this is a non-healing ulcer. Again, if you have an ulcer and that is not clearing up after 2 weeks and it's got red and white patches, you can see the white patch or red patch. Medical term for white patch is leukoplakia, for red patch is erythroplakia. So if you see anything like this, and to have ulcer on the lateral border of the tongue is a red flag. And at times they use screening tools like using a dye to find out which tissues are cancerous. All those are part of the test they carry out. If you look at this patient's mouth, you can know that there's a lot going on here. There's poor oral hygiene. There are things around the lips, soreness, neglected dentition, poor oral hygiene, but there could also be an underlying medical condition. When people are going through a lot, they forget about their oral dentition. So if, for example, people are taking medication or on any other health problems, they do not really care about their oral cavity. But the oral cavity can tell you that there's something not right. So it's very important to seek medical attention. Lifestyle choices. So the ways to reduce your cancer risk is on the screen. I'm not saying it. This is by the World Health Organization. It's saying do not use smoke or use any form of tobacco. Some patients, when you ask them, do you smoke? They said, I don't smoke. They tell you, I vape. But vape, I'm sure, has got a little bit of nicotine in it. And drinking alcohol, you can drink in moderation, but too much of everything is not good for you. So you need to find that fine balance. You are the only one who can make that choice. I remember doing dissection, when you look at the lungs of people who smoke, they've got these black spots in their lungs. It looks unhealthy. So that tells you that that person is a smoker. So this is what it looks like. I think this is a postmortem of how the lungs look with black spots. So the head and neck, today we're just trying to create awareness about oral cancer screening. So in order to conclude, we need to visit the dentist regularly, change our lifestyle, do DIY self-examination. I think I've finished for now. We'll go to question and answers, but I would love if Sam can play the video from his end. And then, so before we move on to questions and answers. Thank you. Thank you for listening.
Thank you, Dr. Glavee. That was super insightful and incredibly useful. I think one of the take-home messages I took from that was, we have to keep an eye on ourselves and monitor ourselves, both externally and internally, our face and our oral cavity, our mouth, should I say, really, to see what's normal, so we know what's normal, and then that allows us to see or identify when things aren't what they used to be, and that's that big signpost of red flag to really go seek help. So that was incredibly useful. Whilst I wait for questions and see whether or not we get those links on the chat, and maybe share one of the two of the videos. I just have a few questions for you, if possible. So I guess for me, one of the things is that infographic, that slide you showed where you were demonstrating those steps to good or to that 2-minute examination. Is that available on the NHS website, or is that something that do you know where we could find that to use in the future?
Oh, it's on the mouth cancer education, but I'm happy to say, Sam said he didn't get my slides. I emailed it to him yesterday.
Okay,
So
don't
I
worry.
don't know.
Yeah, that's okay.
I don't know whether to minimize and then put the links to the videos, because the videos show, a picture is worth 1,000 words.
Good,
But
yeah.
I don't know what you
Yeah.
think. Do you think I
Well,
should put the link? What are
I,
your
I,
thoughts?
I wonder whether it's useful if we can get those links later then, and then when
All
we put
right,
them
okay.
back online, then we can always share them as part of the caption. That makes
All
people
right, okay.
often
Okay.
might be more useful.
People are
So I have one question in the chat from that goes along the lines of, can the people working in an area where people smoke be at risk of oral cancer?
Yes, they could be. I know there was a famous case on the news. There was a very famous case. I've forgotten this gentleman's name.
Mm.
He used to work in a club and he used to play the saxophone. So even though he wasn't a smoker, he ended up developing cancer. It was a very big case in this country. I think he developed lung cancer or something like that.
Okay.
Yeah. So,
Oh, yeah.
yeah. And the lifestyle. So if you smoke and you drink, yeah,
Mm.
the risk is high. Yeah.
Okay. So yes.
Likely.
So basically, the risk of smoke, basically being in smoking environments, is just a high risk of developing cancers of any form. Really, that I think that's what you're implying to.
Oh, yes, Roy Castle.
Sorry,
Yeah,
Castle.
yeah, yeah. Thank you, Zana. That's true. Roy Castle. It was a very famous case.
Yeah.
He was so upset. Yeah, yeah.
Okay.
Thank you.
So, as someone who, so my area of specialty is skin health, so dermatology, and so obviously for us, we often look at the skin and in dark skin types, we often see inflammation, redness, more darker hyperpigmentation. Do you often find that patients who are of, say, non-European ancestry who come to you often a bit more delayed in coming over? Is there any concerns or hesitancies with patients and in seeking help? And how would you advise patients who are worried to go about seeking help for their mouth issues?
Well, they just come to see us. I'm very passionate about oral health, dental prevention. I am a preventative dental surgeon. I'm very passionate about prevention. That's why I'm doing this. Dental prevention is better than care. Why do we have to wait till something gets really worse? It becomes very difficult to treat. So, for example, if you have tooth decay, this is an example, and you come in early, we can feel it. But if you ignore it and it hits the nerve, then the complications are pain, risk pain, alternatively do nothing, or see a specialist to do a root canal treatment. But it doesn't mean after the root canal treatment, you may not end up losing the tooth. It's just like saying, I know my tooth is not good, but I just want to hold on to it. And the last option is extraction. And losing your teeth is like bereavement. And this is based on research. So, and we only have 2 sets. So you have to be very careful and hold onto your teeth for as long as you can. It's quite heartbreaking when people lose their teeth and they're in tears. You have no idea the impact. And you have to talk about the benefits, the pros and cons. I believe in shared decision making. So I'll go through all those complications, risks, alternatives, benefits, pros and cons. and then you will make the decision. We will all come to a decision. So in answer to your question, why put yourself through all this pain and rather not come regularly? And if there's anything we pick up, we refer you. I remember seeing a gentleman and referred him to the hospital. And the hospital, I don't think they took the man seriously. He went back to the GP. GP referred him to a ENT surgeon. And it turned out that he had cancer of the throat. Now, there's something I forgot to mention. I need to mention it now. One may ask, what are the signs and the symptoms? It's very, very important. So the sign, so if someone says, what is the sign is what you see. The symptom is something you are feeling. So some of the signs and symptoms of cancer are, or oral cancer to be specific, fatigue, nausea, lump on the lips and the mouth or throat or neck, feeling of cheek thickness. So that's why it's good to know the norm and the norm. Red or white patches or spots on the gums or the tongue, persistent sore throat, difficulty in swallowing, or tightness of the jaw and the tongue, numbness of the mouth and the tongue, and change in your voice. Your voice can become hoarse. All of a sudden, one day you wake up, your voice is sounding very different, and you cannot swallow. And then bleeding or pain and bleeding in the mouth, your dentures don't fit. Oh, and bleeding in the mouth. Let's talk about this. A healthy mouth should not bleed. So after you've been to the dentist and they've treated it from a periodontal point of view, that is gum problem, hygiene, and you still have an unusual bleeding and your teeth are loose, then it could be there's an underlying medical condition and you need to seek medical attention. If you go to the GP and they carry out a blood test, and for example, your white blood cells are high, we do know you are fighting something seriously, and he or she may send you for further tests, a biopsy, or things like that. Thank you.
Okay, great. Thank you so much. That was really useful. So I have some more questions for you. So the first question is, what about vaping? Is vaping bad?
To be honest with you, I don't even know how vaping works, but I do know that when I ask people, do you smoke? They say, no, I vape. It's still taking in some form of nicotine, whether they dilute it with mint oil or whatever. You're still inhaling something. Okay. So it's going to have some impact some way or the other. It's a lifestyle disease. I know people tell me, oh, I'm trying to stop. Do you know I used to have 20 cigarettes a day? Or some people take the herbal ones. When you take the herbal ones, some people take it because of pain. Some people take herbal smoking. I'm not here to judge anybody. It's a lifestyle. The choice is yours. My job is to just inform you that if you smoke and you drink, your oral cancer risk is high. Thank you.
Okay, thank you. I think just along those lines, perhaps I can answer this one for you. The question was, can vaping affect non-smokers at work, please? I think from my understanding that the literature, the evidence on that isn't quite clear cut yet, so we can't really answer that question for you. Sorry to say. And then a few other comments we have. I'm sure you agree with this, Dr. Glavee. Regular dental visits are important because you cannot see inside your mouth. And I think one of the questions from that is, can dental disease transform into oral cancer? And how will the dentist or hospital consultant treat oral cancer?
Oh, it all depends. Everybody is different. So if it's cut in the early stages, they know the treatment to fill. But if it gets to the worst stages, then they have to operate. And at times, I've come across people who've had part of their tongue removed, including part of the lymph nodes and things like that. So that is why prevention is better than cure. At times, I don't know if you've come across someone who's had oral cancer, and if you look in their mouth, half the tongue, half the face is gone. Some people even end up with artificial eyes. So you don't want to put yourself through all that. Because when they are doing the dissection, they try to remove it with part of the lymph nodes. So yeah, so it can be quite radical.
Yeah. So basically, like I said, each individual is different. So and therefore it's very hard to define a pathway for each person.
Everybody's different. Everybody's unique.
Yeah. Another question along those lines. Are other cancers from other parts of the body, are there other cancers from other parts of the body that can present in the mouth?
As I said, the mouth is like a mirror image of the body. And I mentioned oral manifestations of systemic diseases. There are certain things you cannot say because it all depends on literature, evidence-based. I'm very passionate about evidence-based. If I've not seen a literature on something, I never mention about it. But I do know that people have had lichen planus in some parts of the body and it shows in the mouth. Some people have got some, like for example, HIV, and it shows in the mouth. There are some manifestations with it and all that sort of combination and lifestyle choices. So there is a probability that can happen because the mouth is like a mirror of the body. Yeah.
Yeah. And then, okay, so on different tact, is extreme dry mouth, especially at night, anything to be concerned about?
Well, you can use artificial saliva. It could be your mouth breathing. It's also, the thing with dry mouth is that there are certain health conditions that affect dry mouth, like certain medications, some of the side effects. And you need to use maybe sodium fluoride mouthwash. You need to go to the dentist to prescribe sodium fluoride toothpaste. The reason is because when you have dry mouth, the saliva is not washing away the acid. So the bacteria is stuck to your teeth and lead to increased decay in your mouth. So it is good to seek medical attention and then see an oral medicine specialist to find out why you are having that sort of issue. It could be an autoimmune disease. So there's a lot going on there.
Okay, great. Thank you. Okay, I think we've got one final question, which I don't know whether you'll be able to answer because from someone who treats sarcoidosis, I think that there are different medications to be used, but the question is, do you know how sarcoidosis and the medication that has to be taken affects the mouth?
No, I don't.
Okay. So no, it's not a funny question. No, it's basically the reason why we laugh is because it's very much patient dependent. So we it's very hard for us to answer questions without knowing the medication that's being used, and quite often the people who prescribe those medications are the ones who have the experience and those potential adverse additional effects. Yes, so even steroids have benefits and risks, and that's something that you need to discuss with your clinician, your consultant. As someone who prescribes steroids, generally and methotrexate, those things generally they're not known reports to have effects on the oral cavity. But again, speak to your not known to have high effects on the oral cavity, should I say? So those things which you should probably speak to your doctor personally about, and really really have an understanding from them. Caroline, you've got a question to ask. You can unmute you can unmute yourself if you want to. Okay. Caroline, you can unmute. Oh, you're not closed.
It wasn't allowing me to unmute it when I
Sorry.
press on it. So
Sorry,
I think
my
you have
fault.
to do it on your side. Yeah.
Yep.
Okay. So what I meant by that is, okay, it's all well and good what you're saying, but we need a bit broader because some of us are on medications, and if we're taking them and we don't know it's affecting our oral hygiene, then how would we, basically get it treated? Because I know you're saying that with steroids that you prescribe and methotrexate, you don't know that, but I did not have an oral problem up until that point, and that's the two medications that I do take. So clearly, like you said, it affects people in different ways, but we need to know some sort of we need to have a list of medications that we need to be aware of that when we're taking is going to cause XYZ. Because if you kind of broaden it to say, well, you don't know, then that means we haven't done enough research. We could be brushing our teeth till kingdom come. It wouldn't make any difference because of the medications that we're taking. So we need a bit more help as to what we need to be aware of and what is causing whatever problems that we may be having in our mouths. Because I get it randomly. I mean, 1 minute I'm fine, and then another other days I've got sores in my gums and in my teeth. I don't bleed as much, but I know that steroids and methotrexate do have some kind of effect on me. I'm not saying it does with everybody else, but I'm just making people
Yeah.
aware, even though you're not aware
Yes.
yourself as a doctor.
Yeah. Sorry. So, Dr. Glavee, if you don't mind, I can answer that question for you if that's okay.
No, no, it's just interesting because every medication has got a side effect. And
Mm.
normally when they prescribe the medication, they tell you what the side effects are. Now, when it comes to the body and the mouth, and for example, something that is going to make you keep you alive and is going to have impact on the oral cavity, which one will you go for? Will you go for a medication that is going to keep you alive or one that's going to affect your oral cavity? So it's like a two-edged sword. So there are
Yeah,
times
but
that they
that's not the
prescribe
question.
medication. They
That's
prescribe
not the question.
medication
I
and they
understand that,
give
but
you and they may give you alternative. Your GP may decide to give you an alternative. Everybody is different. Everybody's medical condition is different, and there could be interactions. If I tell you do not take a particular medication and you end up with something bad happening to you, then it means I haven't done my job. So it all depends on your history.
I'm
Anyway,
not saying
Chidi, you wanted to say, yeah, Chidi, go ahead.
sorry, I was just gonna say I'm not saying that you should tell people what to take or not to take, because clearly people should know that this information that you give is general information. I'm not going to stop taking something because you said so and so and so. I have to do my research myself. And because you don't know my history, you cannot give a broad general thing. But what I'm saying is we need to have some kind of a listing of, these certain medications that you know of, yeah, can cause teeth to decay or to be whatever. That's all I'm saying. But if you kind of go, oh well, this is what blah blah blah, but and medication can, then we don't really know what kind of medication, what is the literature saying. There must be literature that says, what, if you take XYZ, it can cause you to have gum disease or whatever. That's all I'm saying. That maybe some of your presentation that could have been added. That's all I'm saying. I'm not telling you to tell people what to take, because you can't do that when you don't know their history. That's clear.
So
Well, to me anyway.
That's Caroline. So just to answer on that point, you made clear point that that whenever someone prescribes medication, that they should be made aware of the potential risks to that. The challenge within listing all those is that, again, the medication that people prescribed, when they report side effects, it's reported in what's seen in trials over maybe hundreds and thousands of patients. So that variation, that potential risk or that potential side effect can often be maybe rare, but it's clearly reported. But it's included in the information sheet provided to patients when they get their prescription. So if you're looking at your drugs when you get the medication, there's often a list of potential side effects. So I think often there's a balance between saying everything and adding worry and concern and saying what's common. And we know that most medications that we prescribe, for example, steroids, methotrexate, the risk of oral cancer is very low with them. But yes, sometimes with any medication that can affect your immune system, affect your gut flora, then you may obviously increase the risk of oral thrush. But again, that's something that you speak to your GP. Speak to the prescriber who prescribed that for you, and often you have that good relationship with that. You can develop that good relationship with them so they can alleviate some of the concerns, or at least direct you to the right places to get those additional informations. I'm just going to move on because we've got a couple of minutes left before we have to close over. So thank you, Caroline. So the final question we have is, are you more likely to get oral cancer in the tropics or from eating African or Caribbean foods?
Oh, wow. How? Well, it's quite an interesting question because what I do know, again, this is research. People in the South Asia who chew areca nuts and betel nuts are prone to oral cancer. So there are certain types of food that's carcinogenic. So it's up to you to know. What I know is betel nuts but Afro-Caribbean food, I doubt it.
Okay, thank you. Okay, thank you, everyone. I think these are all the questions that we've had today. I hope everyone's found it really useful, because for me, Glavee, you've given some great insights, and I think it's those steps you've outlined for good oral care and oral hygiene is so important. And I'm so glad that we can have this recording to be seen again online, on YouTube, and I think on LinkedIn as well. And I believe Sam's going to get those links available to us on those chats as well. So it'd be really useful for everyone who's found this useful to go back onto the to resources later on, to click on those links and find more information. Now,
sorry, Michael has put something in the chat, which is very, very important. Drags.com. Thank you, Michael, for that. Drags.com. When you go there, it gives you the side effects of all medication. So
amazing. Thank you. Okay, so now I'm going to pass you on to Helny to close off the session. But again, thank you again for everyone who's viewed across the world from our different platforms, and please don't forget to share this with your friends, family, and loved ones.
Hi, Chinedu. Thank you very much. Sorry, I'm just trying to, if you give me one moment, to share my screen.
So whilst Helny gets ready, again, so remember, CAHN Health Hours every weekend, every Saturday. So I will try to do it for an hour of your time. That doesn't mean you have to stay and watch it once. Remember, there's previous sessions from the previous weeks which you may find useful. So do make sure you find us on YouTube and on our other platforms to go back, reference, and learn something new, because I think each time I've been here now, I've learned something more insightful, made me take care of myself a little bit better, but also share some and discuss with some great and insightful people.
Thank you, Chinedu. Just checking, can everyone see my screen?
You can see your screen, yeah.
Amazing. Okay. So just to say thank you, everyone, for joining.
Helny, you're not on the presentation.
Yeah. All right. Oh, I'm sorry. Can you hear me?
Yeah, I can hear you. You just need to share your presentation.
Okay, 2 seconds.
So click on the PowerPoint tab. Sorry.
Right.
Okay, so whilst you get on with that, yeah, so I get on with that. Yes, so so I think last week we had a great talk from Dr. Oge. Was it the week before? And then obviously I've done talk on dermatological conditions, but now, Helny, I'll pass on to you. I think you're ready.
All right, thank you. Again, as I was saying, thank you, Chinedu. Just to say, everyone, thank you for joining today's session. And just to remind you, we would return every week on Saturday from 11 a.m. to about 12:15. So you can scan the QR code. Don't forget to share with your family and friends so that they can also benefit from these helpful insights that we're getting today. Again, just to invite you for our carol service, which you will be holding at the Manchester Cathedral on the 11th of December at 7 p.m. It's completely free to enter. You just need to scan the QR code and register your information. And if you'd like more information, we'll make the flyers available to you, and you can contact us as well. We also have our Green and Arts Wellbeing Service, which is at Bolton every Wednesday and at Stockport every Tuesday. Please come around, engage with the community, activities like painting, you can have nature works, and there's so many skills that you can learn at the hubs. This is an opportunity for you to share your experiences with the NHS, so that we obviously can shape how we receive healthcare, which is important for our community, just to make sure that our voices are heard and our experiences are factored into the the healthcare delivery plans that we receive. So please scan the QR code and feel free to share your experiences and your opinions and how you feel like Black people should be, seen in the healthcare space. Tomorrow we would be honoring the loved ones that we have lost to HIV. As you know, our community has been the most affected when it comes to HIV, and tomorrow we'll be honoring them on Friday. So I think that's Friday, 1st of December, rather, at 11 a.m. Please come together. Let's pray. Let's fight against HIV. The location will be at the World Harvest Christian Center, and all the information is available if you just scan the QR code. And again, if you reach out to any of us, we would be happy to give you more information, and feel free to contact Fabiola. Her contact information is just at the bottom here if you'd like to attend and if you'd like to get more information about the service. And finally, if you know anyone who has experienced loss in terms of miscarriage or has experienced losing their baby, we also have a bereavement session available for them. You'd be able to access grief counseling and different support groups and different resources that would help you through such tough time. So it starts on the 5th of December at 6:30 p.m. to 8 p.m. If you need more information, again, the contact information is just right here, but feel free to reach out to any of us in the CAHN team and we would provide support for you. Thank you for joining us today, and we hope that we'll see you again next week. Remember, it is every Saturday from 11 a.m. till 12:15 p.m. Please come around and get more information, stay aware, and stay safe. Thank you very much, Chinedu.
Goodbye, everyone.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.